On-the-scene coverage of ACC.13 is supported by Janssen Pharmaceuticals, Incorporated.
Christina Fiore with MedPage Today. My question is on the partner trial. With regard to the paravalvular leaks and the aortic regurgitations, there were some concerns with the long-term data from the Partner 1 study. Are there any concerns with regard to long-term survival for the Partner 2 as well?
Well, first, we worry about everything. It's part of our DNA, I'm afraid. The three major problems that arose from the Partner 1 trial, even though the results were quite good, in fact, unexpectedly good, had to do with vascular complications, had to do with strokes, and had to do with this issue of paravalvular leak that was generally not associated with immediate problems, but was associated with, and we don't quite know the causality, with what appears to be a higher frequency of late mortality. This particular device certainly seems to address some of the issues of vascular complications importantly. The stroke rates have gone down appreciably with both devices, and we could discuss or not discuss why that is, but now that seems to be less of a concern, and what's left behind is this paravalvular leak issue, which is real. The actual numbers I would pay less attention to because this is very core lab dependent, and the core lab for Partner 1 was at Duke, for Partner 2 was at the Cleveland Clinic. Their methods of making these analyses are slightly different, and even the same device had a different frequency of paravalvular leak, the SAPIEN, in the two studies from the two different core labs. So I pay less attention to that. And the issue is there a difference, though, between SAPIEN XT and SAPIEN with regard to paravalvular leak? And the simple answer is there was a trend, and we're not entirely sure. The trend was not statistically significant. It was confounded by the fact that the SAPIEN, the original device, had a it had several patients that required a second stent. The second stent was usually because of severe paravalvular leak. So it confounds the analysis a little bit. And we're not sure if intrinsically one device versus another has a higher or lower paravalvular leak. We're going to need to look at that in some additional selective studies. The real answer, because no matter how we look at it, there's still going to be 10, 15% moderate severe paravalvular leak with this device, which is not as good as it needs to be in the future, I think. The SAPIEN 3, the next device, has an external cuff, which at least in the early studies seemed to have, if not completely, largely eliminated paravalvular leak by filling the spaces between the frame and the native annulus. So I think you may have to wait another generation of devices to solve that problem.